Hey guys, Dr. Kilfoil here with Podiatry Explained, and we have today a percutaneous tenotomy times 3. We're going to be doing 3 of them on this patient who's had these chronic hammered toes, and she's unfortunately been misled to think that she has to be off of her feet for weeks on end in order to get these kind of things corrected. So right here today on Podiatry Explained, we're going to disprove that right now. Thanks. Okay, so this patient she's a very old lady. She's had hammer toes her whole life, and other podiatrists, or maybe even other doctors, have told her that you don't want to have a hammer toe procedure because you're going to be off your feet for months. You're going to need crutches, and you don't want to do that, which is completely untrue. Even for more aggressive procedures, like even the wile osteotomy, you could at least put your foot down. You don't need crutches from anybody who knows what the heck they're talking about. A lot of times doctors who say that are not capable of doing the surgery and are trying to dissuade people so they don't lose the patient. It's a very cynical way to practice medicine, but I hear it all the time. To me, it's disgusting. So here we see the patient is about to get a soft tissue procedure because of these mostly flexible, semi-rigid hammer toes. She is very old. I'm not trying to get her cleared by her primary medical doctor to get intubated in the hospital, but she's walking on the tips of her toes. God intended you to put your weight on the pads of your toes. She's walking on the tips over here. So she had one on last week on the left third toe, which is the only one that's like that. And here on the right foot, she has 3 of them in a row like that. So we're going to be targeting the flexor digitorum brevis, flexor digitorum longus, and not the brevis. And we're gonna put a little graph up here to show the difference. We numb the toe, and here I'm using a 22 gauge needle, and I'm going to poke it through, and I'm going to literally wiggle this thing. Now listen to the noise. That celery stick kind of sound you hear is the flexor tendon that's being cut right now. And I could do it with a literal needle. You don't need to have even a single stitch. Put it in there, wiggle that needle, all while I'm putting extensive pressure onto the toe. When I feel it, when I'm starting to hear it, you'll feel it. Bam, 1 down, we got it. Now you can already see that there's some relief of that deformity. It doesn't need a lot. Okay, so we've done the second toe. Next, we're gonna be doing the third and fourth toe. So here we go. Next, we're going to just throw some local in it. It's painful to put local anesthesia through the bottom of the foot. I'm putting it through the side. This is a tough lady, she can handle it. And there you go, she's kicking a little bit. There's definitely a risk of me sticking myself in this situation. All right, so here's the local anesthetic part. I use a lidocaine. Here's another thing that boomer-ass podiatrists who don't know what they're talking about like to inform their patients of or perpetuate the myth of. Literally, there are articles out here, but here's a message to my younger podiatrist friends. If you have something coming out of your mouth that an older podiatrist taught you and you've never read the paper yourself, read the paper. Because you'll be surprised how often it's not true. All right, here we go. Now we're doing the wiggle thing on toe number 3.
And now
For the celery sound.
There, I just felt the pop.
There. So we're gonna be splinting these things. All right, here now we're going for number 4. Put it in there. Celery sound. Notice I'm flexing that thing north. And then it just gives. Bam, she's gonna be so happy with this. You're gonna be surprised. For diabetic wounds on neuropathic patients, this solves it in a single visit. Here my medical assistant is videotaping, so she couldn't really help me hand stuff to me. So forgive me for that. Here I'm using Hypofix and just a rolled up gauze to splint the patient into extension. I don't want the skin and the chronic contracture that's been going on to pull this patient back down into flexion. So I ask the patient to keep that bandage on for a week. No stitches, no dressing changes, just keep it on as best you can. I usually dispense 1 or 2 extra, and I show the aide or the daughter or the patient herself how to do it. This is typically reserved for patients who are a little bit older and we're just trying to use some mild procedures to ameliorate their pain. Obviously, this is not going to make any cosmetic improvement, but it's because this patient's coming in every 3-4 weeks with these painful toes, and I'm tired of cutting calluses. I'm done with that crap. I offer it to these patients, and yet they keep on repeating to me the same thing that some bad doctor once told them. And I had to do the left foot procedure just to prove it to her. So I did the left foot procedure. She came back and she was, I want the other 3 done. Got it. You got it, lady. I'm here to help you. Anyway, sign off. This is Dr. Roger Kilfoil. Please hit that like and subscribe. Hit that notification bell for more. And just remember, every day is the best day of your life. Oh, I didn't see you there. Well, I know some of you guys like ASMR and you like feet. So that celery sound that I was talking about before, we're just gonna play that on repeat right now. So enjoy. And once again, thanks for watching, like and subscribe. Make sure you hit the notification bell so you get all updates on my newest videos. And always remember, every day is the best day of your life.